Good afternoon, everyone. Thank you so much for joining us. I would like to just begin by acknowledging the traditional custodians of the land on which we meet today. For myself here in Wollongong, it's the Wadi Wadi people of the Darawal Nation, and I'd like to pay my respects to elders past, present, and emerging, and extend respect to other Aboriginal and Torres Strait Islander people who may be on the call with us today. So for those of you who don't know me, my name is Hannah and I'm the Community Relations Coordinator at Cancer Council New South Wales. I've had the privilege of being in touch with most of you either over the phone or by email during the March Charge. So it's been great to see you and see some familiar faces here today. As Australia's largest cancer charity, we undertake our work across all cancer types for people of all ages and all social, economical, and racial backgrounds. Our tagline says every minute of every hour of every day, we work to reduce the impact of cancer on people across the whole community. And we do a lot of work without government funding. It is the community that funds most of what we do. We support people affected by cancer when they need it most. We speak out on behalf of the community about cancer issues. We empower people to reduce their cancer risk, and we find new ways to better detect and treat cancer through world-class research. Among this group, here we have our incredible diamond charges that raised at least $1,000 for the March charge, as well as other amazing charges that are with us today. So thank you again for joining. As you would be aware, this year's March charge was our biggest ever. We had over 11,000 people who charged over 780,000 kilometres, which really that's equivalent to over 18 laps around the earth if you want to break it down. This together, we actually raised over $2.6 million, which is absolutely incredible. So you should all be very, very proud of that contribution. This year, there were an amazing 615 members of the Diamond Club who were crucial in achieving this major milestone. So we thought, what better way to show our appreciation than inviting you to our exclusive Stepidemiologist Q&A and hearing firsthand how you are making a difference. In case you need a reminder, the Stepidemiologists are a group of epidemiologists, researchers, and support staff at Cancer Council doing everything they can to help prevent cancer and create new interventions and treatments. The team participates every year and have raised over $20,000 for the March charge. We have here with us today Eleanora and Mariana from the team who will talk about hi guys, thanks for joining, who will talk about some of their latest cancer research findings, as well as answer some of the questions that have been submitted by you prior to today. If we have some time at the end, we'll definitely give you a chance to ask any other questions from the team. So on that note, I would like to pass over to our beautiful Stepidemiologists. Welcome, girls.
Thanks, Hannah.
Thanks, Hannah.
I'll start, I guess. My name is Mariana Weber, and I'm a Senior Research Fellow here at Cancer Council in the Daffodil Centre. I lead the Lung Cancer Policy and Evaluation stream, which involves a team of epidemiologists, mathematicians and students, and we're currently focused on studies that generate data to support tobacco control in Australia and to help implement Australia's first lung cancer screening program. And one of the things that we have always loved doing in the research division is going out for a lunchtime run together, which is why I love this event, the March Charge, so much. It's an obvious match for us in the Cancer Research Division in terms of getting involved in the fundraising at Cancer Council. And we've been doing it every year since it started in 2015. So it's really nice to carry it through from year to year and collect photos and show this journey that we've been on together, which is lovely. And the thing that I most love about the March Charge is that it's something healthy and achievable that anyone can do with any level of fitness. And it, without fail, always prompts people in my life to come out of the woodwork and share their stories and experiences with cancer, which I wouldn't normally get otherwise. And I'm always absolutely astounded by the generosity of the people that come and support me. So it's just all around a really great event to be involved in. What about you, Eleanora? I'll hand over to you.
Thanks, Mariana. Hi, everyone. I'm Eleanora Faletto. I'm a senior research fellow as well. I lead our gastrointestinal cancer policy and evaluation stream. And my team look at predominantly bowel cancer and liver cancer, and we look at how to prevent those cancers, but also how we can detect those cancers early. So I participate in the March Charge, and it's for similar reasons to Mariana, but my dog is the reason that I initially got involved. My family has a very fluffy white golden retriever called Gnocchi, who caught the eye of the marketing team and thought, well, he'd look good on the front of the campaign. So Nock just loves being famous, and we got involved, and he loves to run. And I guess what I love most about the March Charge is getting a chance to showcase how beautiful he is. And also it's a really great excuse to get out and push yourself just that little bit further and raise money for such a great cause, because all the money goes to help us do what we would normally do and do it even better and do it for more people. So you guys gave us a whole bunch of questions, and some people are really interested to hear about how we got into cancer research, what we're most proud of, and what our highlights have been. So Mariana, do you want to start?
Yeah, sure. So I came into this role at Cancer Council New South Wales 15 years ago, and I had a background in neuroscience research, and I knew absolutely nothing about cancer at all. And that's one of the things I love about this job, is that we learn new things every single day. And obviously I know a little bit more about cancer now, having learned all about it over the last 15 years. But one thing that I'm most proud of is a study of cancer risk in relation to smoking that we planned from my very first day starting here at Cancer Council 15 years ago. And it was just published last month, which is exciting. It sounds like a long time, but we were following the people in this study for 10 years. And it resulted in the first large-scale study measuring the impact of smoking on cancer risk for Australia ever, which is really exciting. And we got a bit of media pickup, which is also nice. But the highlight for me working at Cancer Council is really the people that I work with. So people like my work wife, Eleanora here, and our director, Professor Karen Canfell. They make me laugh every day, and they're just so clever and encouraging and enthusiastic, and being inspired by the people that you work with is such a gift and makes coming to work such a pleasure. And we have, just everybody will tell you, we have a wonderful work culture here at Cancer Council where everybody is proud to work here and truly respects and does their best to honour the donations that come from the community and people such as you guys who do all the fundraising. What about you, Eleanora?
Well, I can't argue with that highlight. I mean, of course, who wouldn't want to work with me? No, we're very lucky. We have a great bunch of people who are really committed to making a difference and seeing what we can do better, certainly from a policy perspective and how we can influence policymakers. Similar to Mariana, I have a background that wasn't related to cancer at all, and I joined Cancer Council almost 10 years ago now. And what I'm most proud of is that I get to work in an area where, in bowel cancer, especially around bowel cancer screening, where we can make a difference. The more people we get out to and explain that the program exists, that people can screen for bowel cancer, and that if you do, you can catch it even before it becomes a cancer, so we can avoid cancer altogether. It's really special to be able to communicate that to people and to see that people take that seriously. And I love it the most when people come back to me and say, oh, I did my test, or I did what you told me to do. And that's what everyone should do. Definitely do what I tell them to do. So now, Mariana, I'm going to tell you to do something else. Lots of the charges have questions around lung cancer. So given that's your specialty, I'm going to throw them your way. The first one was around how Australia can prevent more cancers and the number one preventative measure for cancer. And I know that's not specifically lung cancer, but I'm going to hazard a guess that you're going to say don't smoke. Am I right?
You're right. Yeah, preventing lung cancer in particular in Australia mainly comes down to tobacco control, but also to limiting exposures to some occupational carcinogens such as diesel engine exhaust, asbestos, silica dust. But the work that we do aims to generate evidence to support policymakers, support government and other health organisations to implement these public health measures, such as, you know, at the moment we're campaigning for a new mass media anti-smoking campaign, which really helps to get the message out there that smoking is bad for you. And one example is a study that we conducted about 5 years ago, which showed that 2 out of every 3 deaths among smokers are caused by their smoking habit. And this was a really, influential study that was out. It got media attention all over the world. And as a result, it was used by the government to support an amendment bill to increase tobacco taxes by 12.5%, which is really exciting to see that kind of impact just from one of our studies getting into Australian legislation. And we know that increasing the cost of cigarettes is one of the best way of discouraging young people in particular from taking up smoking. And, these are the things that have resulted in Australia having one of the lowest smoking prevalences in the world. But there are other ways to prevent cancers, and some of these include avoidance of UV radiation from, don't sunbake, avoiding eating too much processed meat and drinking alcohol. But I have a feeling that you might have another idea about how you can prevent cancers such as bowel cancer. Am I right?
Yeah, well, I kind of gave it away before, didn't I? Screening, definitely. But I mean, we have 3 screening programs in Australia, one for bowel, the population-based screening programs. So ones that are readily available and funded by the government. So it's in bowel, in breast, and in cervix. And certainly in bowel cancer, as I mentioned before, we can prevent the cancer before it even develops. But one of the things that we know is that if a bowel cancer case is diagnosed at stage 1, the survival rate is actually 99%. So that's amazing. If we can catch it early, then we have lots of treatment, lots of options available, and it is essentially a cancer that's curable. One of the ways that we can diagnose it early is through screening. So I certainly would recommend screening as a way of reducing risk. Sorry?
And it's free.
And it's free. Yes, it's very true. How could I forget that? You kind of went through lots of things about your lung cancer prevention program. We had a couple of questions around immunotherapy, though, because lung cancer is still the top cause of cancer death in Australia. And so people are still getting cancer. And we've been asked, is immunotherapy the best treatment option for people with stage 4 lung cancer, specifically with adenocarcinoma?
Yeah, well, in the last 5 years, there's been the most incredible increase in the number of treatment options for people with stage 4 lung cancer. So stage 4 lung cancer is when the cancer has spread outside of the lung, which means that systemic therapy is the main treatment option as opposed to things like surgery. But depending on the type of lung tumour, there are now treatment options other than chemotherapy, and one of these options is immunotherapy. So these drugs are called immune checkpoint inhibitors, and they're drugs that are designed to hijack cancer cells so that they are defenseless against the body's own immune system. And for adenocarcinoma specifically, treatment can depend on whether the tumour has specific gene mutations, such as EGFR, which some people may have heard of. But these more targeted therapies are only effective for tumours that test positive for these mutations. And increasingly, immunotherapy, on the other hand, is now the routine treatment for people with lung cancer. But having said all that, I am not a medical oncologist, and I do know that treatment decisions can depend on all sorts of different factors. So any questions about the best treatment options for a particular lung cancer are better directed at the doctors involved in the patient-specific treatment process.
Yeah, absolutely. I mean, we know that cancer is different in different people, and even the same type of cancer is different in different individuals. So another charger has asked us a really specific question about their mum. So they've said, my mum has stage 4 small cell lung cancer that has spread into other parts. Chemo and radiation has shrunk it slightly. My question is, can anything be done to help with her exhaustion? She can't get up for long periods and sleeps all the time.
Yeah, I'm really sad and sorry to hear about your mum. I know how awful some of these treatments are, and small cell carcinoma in the lung is really one of the aggressive cancers. So that's really sad to hear. And I have to say, I don't know the answer to this question, but I do know that the Lung Foundation has a free lung cancer support nurse telephone service that you can connect with online, and we will add the link to that web address in the chat. But this service is for both patients and for carers at any stage of their lung cancer journey, and is run by highly experienced oncology nurses. And they provide evidence-based information regarding diagnosis, treatment, symptom management, wellbeing, you name it, they're there to help. So we'll copy that address into the chat, and it's easy, it's just an online form, and they'll call you back, I think.
Yeah, and then we also have our 13 11 20 line where people with any type of cancer, patients, carers, if they have any sorts of questions, they can always contact that line. They can call that line, and there'll be professionals on the other end that can answer their questions for sure.
So we've also been asked about the availability of clinical trials in Australia. And there was one particular question where somebody was particularly interested in EMC sarcoma. I know that Cancer Council internally, we don't conduct clinical trials, but Eleanora, do you want to tell us a little bit more about where they can find information?
Yeah, absolutely. Mariana's right. We don't specialise in clinical trials. We do fund external research institutes to do research, and a lot of them do conduct clinical trials. None of the currently funded projects do focus on EMC sarcoma at the moment. But there are also 2 registries where people who are doing clinical trials are required to list it publicly. So one is called the Australian New Zealand Clinical Trials Registry. So that's all of the trials that are being conducted in Australia and New Zealand. And there's also clinicaltrials.gov, which is a US site, and that lists US-based clinical trials, but some of them may have a site in Australia. So they're really good places to look. They're publicly available. You can search any type of cancer for any type of clinical trial. You can see if they're still recruiting, what stage the trial is at, and it gives you a lot of valuable information. None that I was able to find did focus, that were currently open, did focus on EMC sarcoma at the moment. We also got a question about being involved as a clinical pharmacist. So if that's in reference to being involved in clinical trials, those websites would still apply. And you could certainly look there and reach out to different research groups. We certainly do encourage anyone who's interested, who's been involved in the March Charge, for example, to continue to volunteer for Cancer Council, and you can do that on our website. And it's only through your support and your continued contributions that we can do the work that we do. So we really do encourage you to do that if you are keen to stay involved. But people have asked, the money raised and everything that's happened through the March Charge, what contribution has that made to a cancer-free future? So Mariana, did you want to talk to that?
So everything we do at Cancer Council New South Wales works towards this goal of a cancer-free future. So a cancer-free future, God, that's a tongue twister, is our vision. And it enables us to conduct and fund the research that we do, which aims to reduce the impact of cancer. And we focus on lots of different areas as an internal research group, but we also fund different research studies in other organisations. So we have I think it's around $10 million external grant process that's competitive and people can apply for that funding. And we run all sorts of different lab-based research and the sorts of stuff that we don't do in-house. But the money also goes to our advocacy and prevention divisions. So we do a lot of work in the community, educating people on how they can reduce their risk of cancer and advocating for things like Sun Smart programs in New South Wales schools. We also have a Tackling Tobacco program, which aims to see changes in community organised settings such as mental health organisations to reduce smoking rates in those organisations. And we also have things like nutrition programs, so healthy lunchbox for mums and dads who are trying to bring up their kids in the best cancer-free way possible. And we also provide support for people affected by cancer here and now. So we have a pro bono service that helps people with their financial system and financial issues and also legal issues. And we have as Eleanora mentioned before, the hotline that people can call if they have any questions at all to do with cancer. I can't remember, 13, what is it? 13?
13, 11, 20.
20, you think I'd know that after 15 years?
Yeah.
Is wasted. And as I said, we all really, really appreciate the donations that people make, because it really helps us do the work that we do.
Yeah. And I guess when you think about a cancer-free future, it sounds so kind of up in the sky. Are we ever really going to get there? So sometimes it's helpful to think about things that might happen a little bit sooner. So are there any exciting milestones, Mariana, that come to mind that we expect to see in cancer research in our lifetime?
Well, in terms of a cancer-free future, we know that cancer isn't just one disease. So cancer at different body types, different body sites, they're all completely different diseases. So the research involved in one cancer type could, it's just, you're never going to get a cancer-free future from the stuff that we do alone. It really takes a whole global research industry to get on that track. But one cancer we may see eliminated in the future is cervical cancer. And we do a lot of work in CRD around cervical cancer elimination. And Karen Canfield, our director, is a real gun, and she has connected into the WHO, and they are working towards a global elimination of cervical cancer through vaccination and screening, which is really exciting. And I imagine it will happen. I should know that. The modelling results probably tell us what date that will occur.
In Australia, it'll happen in our lifetime that cervical cancer will become a rare cancer. Yeah, it's amazing to think that won't be an issue. Yeah. Certainly doesn't mean women shouldn't be screened, though. That's not what we're saying.
That's how we get rid of it, right?
Yeah, exactly. And vaccination. Don't avoid either of those things. Well, great. Well, those were the questions that we had submitted from the charges. But if anyone has any other questions that they wanted to ask us, obviously we're amazing at answering questions and we're happy to continue on.
Yeah, I guess I'll jump in and ask one. I guess my question was around lung cancer. Obviously, there's a lot of things in the media at the moment around the use of e-cigarettes, particularly with younger people. Do you know of any research that's happening at the moment about e-cigarettes and lung cancer?
Specifically around whether e-cigarettes cause lung cancer? Is that what you mean?
Yeah, I guess that would be the target of that, whether it's Cancer Council or whether there's other research happening elsewhere.
The effect of e-cigarettes on lung cancer is a study that would require years and years of research, because we know that the exposure of tobacco and other toxins to the lungs can take up to 20 or 30 years before it turns into lung cancer. So for example, with smoking, the people that are suffering lung cancer now, it's due to the smoking that happened 20 years ago. So the time frame for really working out whether e-cigarettes cause lung cancer is definitely down the track. But, you know, we do know that there are acute harms of e-cigarettes, and they cause other respiratory diseases, and there are definitely studies out there that are looking at this. But, you know, the evidence is still so unreliable at the moment. It's still so early on in the trajectory of what's going to happen with e-cigarettes. And from a Cancer Council perspective, we try and make our position statements as much as possible based on evidence, and the evidence for whether e-cigarettes are harmless is really just not there. So at this point, we don't advise anybody use e-cigarettes until more evidence comes to hand.
I guess with e-cigarettes, lots of people have suggested they might be a way of quitting, or and there's certainly not any evidence we've seen that helps in any way.
Yeah, that's right. So, I mean, I guess that's one of the plus sides that is sort of talked about, that it can help people quit, but we know that they're no more effective than the medically approved methods of quitting. So nicotine replacement therapy is medically approved, and you can go to your doctor and get pharmacotherapy to help you quit. And mostly we know that people that do quit do so unaided. So, I mean, there are other ways to quit other than e-cigarettes, which haven't been approved by the FDA. And yeah, it's still a bit of an unknown quantity at this point.
Yeah, and given we work in evidence base, it's not something that has an evidence base around that either. So
yeah, still a work in progress on that one.
Yeah.
Thanks.
Yeah.
Thanks, Tom. Did anyone have any other questions? I might harass you a little bit longer, Mariana, if that's okay. I know that you published a paper recently about smoking in Australia and looking at some contemporary results of what the risk is, and can you talk us through what you've found recently?
Sure, I should have come prepared with my own question for you. Going to be sick of my own voice at this point. Yeah, we found some really interesting results in that study. One of them was that smoking as little as 1 to 5 cigarettes per day meant that current smokers had a 10-fold increase in risk of lung cancer compared to never smokers. So to date, the evidence around smoking intensity in relation to risk hasn't been there for those low intensity or light smokers. So that was a really interesting finding. And I think the proportion of light smokers in Australia is increasing every year. So I think the message that if we can get one message out from that paper, is just that there is no safe level of smoking, and that even cutting down isn't as beneficial as quitting altogether. And we did find really significantly reduced risks of at least 12 other cancer types in relation to quitting smoking. So, you know, the impact is not just on lung cancer, but, you know, when you smoke a cigarette, the risk of cancer occurs at your mouth, everywhere that the smoke touches, from your mouth to your esophagus, to your lungs, it gets into your intestines, your stomach, gets carried straight from your lungs to your heart and your brain, goes through all your organs, your liver, your kidney, your bladder. So yeah, not great.
Yeah, definitely don't smoke.
What about you? There's been a lot of action lately with the National Bowel Cancer Screening Program. I know that your team have been doing some fantastic work modelling the impact of increasing participation. So what is the level of participation at the moment in the National Bowel Cancer Screening Program?
Yeah, look, nationally, the participation sits at around 43%. And so the program itself is for everyone who's 50 to 74. They're automatically eligible to participate in the program. That means they get sent a wonderful test in the mail on their birthday, on their 50th birthday, and every 2 years thereafter. to take a sample or 2 samples of their poo. So understandably, that's not appealing to everyone, but certainly when we do explain to them what it is, what they're doing, and what the impact of that can be, they certainly are more willing to participate. So we found that increasing the participation from 40% to 60% could save up to 84,000 Australian lives to 2040. So that's quite an amazing number. And yeah, we were involved. Cancer Council was awarded some funding from the Commonwealth 2 years ago now to run an ad campaign. And that was successful in increasing the participation of the program. So that was great. And we've been successful in being awarded another $10 million to run an additional campaign, which should air next year. And those campaigns, the aim is to increase awareness and really to target people that are aged 50 to 74 and let them know that if they do receive a kit in the mail, they should do the test. And also, just if anyone knows anyone in that age bracket, if you see a test sitting at someone's house, by all means encourage them to do it. It will and could certainly save their life.
Great. I don't see any other questions coming through on the chat.
Oh, I see Tanya says her dad's done it. I told him all about it. Well done, Tanya. I have to admit, my mother hasn't done it. She still refuses. I can't get through to her. No, it's not for want of trying, I definitely promise. It was suggested to me that I try reverse psychology and say to her, don't do it, and she may do it. But I will keep you posted about how that goes. So yeah, if there aren't any more questions, maybe we'll... Sorry?
I look forward to that update.
Yeah, well, maybe next year. If you do the March charge again next year, come back and I'll tell you whether my mother's done it or not. I think she's waiting until she's ineligible. But yeah, thank you very much, everyone. I'm not sure, Hannah, did you want to say some final words?
Just thank you both for taking the time and going into that length of detail with all of our charges questions. So thank you so much.
No problem. Thanks.
For having us.
Yeah,
we'll see you all next year.
Yeah, see you next year. Bye, everyone.
Bye.